All right, guys. Well, I'm super excited to talk to you all tonight. The whole purpose of our discussion is to talk a little bit about, taking that next step, preparing for parenthood. This is done as part of our programming for Black Maternal Health Week, which spans from April 11th to April 17th. So we're catching you right at the tail end of the week. And it's been an incredible week that put on a lot of different programming, and so this is something that I felt really wanted to do, to talk to people, primarily because I feel like there's so much anxiety that I'm noticing amongst Black women about becoming a mother, and rates of maternal morbidity and mortality that are in the news, and we want to draw awareness to. But I really just want to bring it back and focus on things that you can do as you're taking that next step, or even just, planning for motherhood. So for anyone who does not know me, let's see, how can I? So I'm Dr. Tia Jackson-Bey. I'm a reproductive endocrinologist and infertility specialist. And in our world, we shorten that to REI. What we do in our field is that we have a unique understanding of all aspects of health that can impact reproduction. So our day job is helping people to become pregnant, but any, issue that could potentially negatively impact your reproduction is also under our domain. So we understand complex hormonal interactions, the functions of reproductive organs, and therefore how to know that they're not functioning appropriately. Evaluation of treatment of infertility is something that we do on a daily basis. And then all processes necessary for conception and early pregnancy, we also see. And as I mentioned earlier, this is one of the events attached to Black Maternal Health Week. And the theme of the week this year is Our Bodies Still Belong to Us, Reproductive Justice Now. And I thought this was such an important message, really resonated with me, because I think at this point in our awareness, it's good to know, it's good to have the data, it's good to have the statistics, but we also have to kind of temper that with things that we are able to control, to understand that, again, we have to have this connection with our bodies and help ourselves to be in the best position possible for parenthood. And so regarding maternal mortality, the statistics that we hear again is that Black women are 3 times more likely to die from a pregnancy-related cause than white women in this country. Another really significant portion of the report that gave us this data is that an estimated 80% of these pregnancy-related deaths were deemed to be preventable. So it's not all up to chance. It's not all up to, a one-off or something that could not have at all been avoided. And so that brings us back around to, well, what's going on here? What are these causes of death? So from the same report, the 6 most frequent underlying causes of pregnancy-related death accounted for over 75% of all pregnancy-related deaths. So that just meant in this domain of these top 6 issues was where really the biggest burden was concentrated. And so this is mental health conditions, including both postpartum depression, anxiety, including suicide, hemorrhage from delivery. Cardiac and coronary conditions are also really high, as well as infection after delivery, thrombotic embolism, what we think of as a blood clot in the legs or lungs, as well as cardiomyopathy, which is a condition where the heart muscle actually weakens and can have, inferior function as a result of the strain from pregnancy. But the issue is, cardiac and coronary conditions were among the leading underlying cause of pregnancy-related deaths amongst non-Hispanic Black mothers. So this includes, issues of coronary artery disease, which fell under this cardiac issue. Cardiomyopathy, which I mentioned, again, has to do with this kind of weakening and suboptimal function of the heart. Blood clots, VTE, venous thrombotic embolism, blood clots in the legs or the lungs. Hemorrhage, which, the body is equipped to manage actually a pretty large amount of blood loss from delivery, either via vaginal delivery or C-section, but when in excess of that, that hemorrhage can become life-threatening. As well as high blood pressure, hypertensive disorders, either of pregnancy, that are exacerbated or worsened by pregnancy, like preeclampsia or eclampsia. So these are particularly concentrated amongst non-Hispanic Black mothers as their top causes of death, which is different than the overall causes of death for all women. And so this, kind of highlights this disparity in terms of not only do Black women have a higher burden of these maternal deaths, but then the reasons why they're dying seem to be different than everyone else. Why would that be? There is a role of kind of underlying health conditions, things that, either were uncovered from pregnancy, kind of manifested in pregnancy, but maybe were there all along, or chronic medical conditions that may be suboptimally managed in pregnancy and worsen and causes the death. There can also be, huge differences in the quality of care that some women are receiving, particularly Black women. And that's a big, thing that many groups are focusing on, is how do we get to the point when everyone is receiving the same level of care? As well as social determinants of health. You may hear this term a lot. This has to do with, things that are kind of in our society that actually have impact on our health. How much education you had, where in a city or state or country you live. Is it urban? Is it rural? Insurance status, language spoken. These things also contribute to health outcomes in a way that really shouldn't. If we're all in this country, we should have equal access to healthcare, but unfortunately, that's just not the case. There's also this huge component of racism that cannot be ignored. And I'm really encouraged by everyone from the CDC to politicians and even healthcare institutions really starting to pay attention to the role and impact of racism as an independent risk factor for maternal health and maternal death. There's other terms that you may hear in conjunction with this: structural violence, implicit or unconscious bias, and kind of institutionalized racism, which may mean that two women come in labor or with a pregnancy issue and receive different standards of care based on how they look, not even how they self-identify, but how the provider or whoever they're interacting with identifies them. So the reason that, again, this theme for this week resonated with me so much is because, again, we have to, work on this, major, huge public health issue from different ways. And some of it is going to be policy, some of it is going to be structural and institutional. There's definitely a role for community-led efforts, but then bringing it back to the individual as well. Your body belongs to you. And this is, how you are living this earthly experience. And there are ways that you can care for yourself that may put you in a better mental, physical, or just life state to be able to really have a safe and healthy pregnancy. So, I think a lot of people, or in my world, in obstetrics, really try to, bring home the point that pregnancy is a marathon, right? This is not a casual sprint. This is an endurance event, a cardiovascular endurance event for most people. And so there's preparation involved. The same way that you would prepare for a race, you don't just show up cold turkey to run 26 miles. There's planning, there's training, there's preparation, there's actually care to your body, changes in your diet, all of these different things that may need to take place to help you to be fit. And so while everyone may not have the opportunity to plan for their pregnancy, the vast majority of pregnancies are unplanned, and that's fine. But if you're in the position and you have this luxury of time to be able to say, okay, What do I need to do? How can I do the work, as Ian Van Zant says? Then I think that you should really kind of own that and be able to reclaim the narrative. Let's focus on what's important for us and how we can prepare for this very important, huge life event. You know, much like a marathon, you train for college, you train for a move across country, you train for marriage, you train for all these huge life events, and maybe pregnancy doesn't need to be any different in that regard. So we'll talk a little bit about, changes in the mind, body, and life to help your mental health and well-being, obtain the best health possible, and finding adjustments and support that you need along the way. So again, I cannot, overstate the importance of community, particularly in African American and Black American culture, and focusing again on community and how you want to show up, and how you want to be supported, I think is one of the first steps in taking care and preparing yourself. So who is your village? Define your village. Who are these people that you would want in your life around to help provide support both during and after pregnancy? This can be different than maybe your immediate family or even your significant other. Having discussions with friends, neighbors, your in-laws, loved ones, even trusted coworkers or support groups can be very helpful. Talk to them about the role that maybe you would want for them to play in your pregnancy or postpartum period. Someone who can be a stand-in if your partner can't make it with you to visits, or people at work to maybe know who your emergency contact is. Someone who knows where you keep certain things in your house, or even know how to get into your house if they needed to, if you needed some help in an emergency, where you kept your medication or your clothes or extra house keys, things like that stored. And so I think defining your village is definitely a starting point. There's all these points of connection with building a village. I hear so many people say, start talking to other moms, people who you admire, who who have been through it, people who may even be grandparents now, or influential people in the community. Start your fact gathering. You want to ask questions, talk to them about what your goals may be, seek their guidance from experience. You may even, get ideas from reading and books and things like that. But also there may be resources around you that can be, more helpful or specific to where you are in your stage of life. Is it queer family building? Is it single parenting? Is it, a pregnancy after loss or something like that? Online chat groups can also be really helpful. I've heard time and time again of pages on Reddit, on Facebook in particular. I mean, there's a group for everything. Can be really specific to where you live regionally, culture, your job, Black single lawyer moms in Brooklyn. Like literally, it can get granular. Your sexual orientation, marital status, things like that. So just different ways to help you find and build connection and start to really get curious. Now, of course, I want to talk a little bit about mental health, because I think that this is super important as a next kind of point in your preparation. I talk a lot about the mind-body connection because I do think that, women in general, and particularly Black women, spend so much time taking care of everyone else, taking care of family and working hard on a job, and being a civic leader, engaged in community activities in your places of worship, and not enough time focusing on yourself. And through the course of our life, we may actually start to lose this connection with things that our body is telling us. This intuition that children have and that young people have kind of dissipates as you get older and you start to not trust yourself. So, finding this mind-body connection, be it through meditation or prayer or some other kind of quiet practice, journaling, can be super important in pregnancy, and being able to pick up on those clues when something isn't right. Listening to, that you're not a person who gets headaches, but now all of a sudden you've had a headache for 2 days. Listening to these things about your body can be super important. So I always urge people to take the time to master yourself, get to learn yourself, and take that with you into the next phase of life. Vision boarding. If this is something that appeals to you and you're a visual person, make it plain, put it out there in front of you. Women come to me a lot saying they don't want to die. And while I completely understand the sentiment, that is not how I want you to enter pregnancy. I don't want you to enter pregnancy thinking about death or even things that you don't want. I want you to think about the things you want. What will it look like? What will it feel like? What will it smell like? Who's there with you? Where do you live? What kind of scenarios will you find yourself in? I think, visualization can be an incredibly useful tool. So much about pregnancy can be a completely new experience, uncharted if it's your first time being pregnant, or even if you're with a new doctor than last time, or a different job, or a new neighborhood, or any of these kind of circumstances can kind of add this new and uncharted element. So I think thinking a lot about what is comforting to you, what does support look like for you, what is this process, creating a vision of what you want can be very, very important. Another part of, mental health and addressing this is dealing with past trauma. This may be trauma from prior deliveries, prior abortions, grief of pregnancy loss, or even the grieving process that happens with infertility. We know so well that even with a positive pregnancy test and graduation from our clinics, it doesn't always resolve that grief that it took to get to this point. There's other levels of, kind of unresolved issues around sexual abuse, difficult relationship dynamics, differences with your own parents and parenting. And these issues don't magically resolve with a positive pregnancy test. So I definitely want anyone who's considering pregnancy to take time. Dealing with this can actually decrease your risk for mood disorders in pregnancy and postpartum, and it may help you to develop coping strategies that serve you well beyond pregnancy. So, finding a therapist is something I talk to patients about a lot, talk to my friends about, family about, communicate with your provider about your timeline for pregnancy. There may be a role for medication or changes to existing medications that you're on that we may want to change, as you're planning. A lot of people ask about how do you find a therapist? There's so many different ways that I have listed here, including, employee assistance programs through your job. You can go through your insurance company, ask around, ask friends and colleagues and who they go to, who would they recommend. You can ask your physicians for a referral. And then online directories like Therapy for Black Girls or Therapy for Black Men could be incredibly helpful. This is find people who are close to you or who may have like a digital or virtual sessions. So we cannot, understate the importance of our physical health. And so I think one of the first things is taking this time before pregnancy to figure out who's on your healthcare team. Do you have a primary care doctor? Do you have a gynecologist who's an obstetrician? Because not all gynecologists will take care of you once you're pregnant. And it's okay to ask that. And, I'm thinking about becoming pregnant. Is this something that, you would I would continue to come to you? Or should I go somewhere else, and maybe taking the time to even schedule an appointment with that person? If you have subspecialists that you need, or if you're interested in like a doula for labor support, this could be the great time to find those team members. Start by reviewing options maybe in your community. You can go with recommendations from friends or family, or even, as I mentioned, through the providers in your insurance network. By scheduling an appointment now, you have the opportunity to see, is this the best fit for you for your prenatal care? And you can get acquainted with how the practice works and ask questions and expectations for care. And this expands beyond just physicians. This is your doctor, your dentist, therapist, nutritionist, physical therapist, your personal trainer, anyone who you may see on a regular basis for your chronic medical conditions. Make sure that they are aware that you are planning to become pregnant so that they can have that on their mind as they plan your treatment. Things to think about here. I have a long list of questions, but things to think about when you're entering a new space. Do you feel comfortable with the provider? What is the vibe? The kids want to know a vibe check. What is the vibe when you walk into this space? Is it somewhere that you feel comfortable, getting your care? Do you feel like your questions are answered? How accessible are staff? Feel free to screenshot this page just so that you can have an idea of the kinds of things to think about when you're going to a new practice. Health insurance. This is, a blessing and a not so blessing in many different ways because it can be limiting. And so using this time prior to pregnancy to kind of figure out your healthcare landscape. What is covered on your health insurance? Are there treatments that aren't covered? Are there providers that are not covered? Certain hospital system, will you be designated to one place? If you need to change, let's look into when open enrollment is and see what the options are there. Knowing the specifics about what you are responsible for financially, co-pays, deductibles. I've even known people who have changed jobs, change roles, maybe go from a consultant or a freelancer to a full-time job so that they can make sure that their health care is up to date, their health insurance is up to date and ready to helping them prepare to become a parent. Health screenings, I can't understate. If, we've all been through this pandemic and got a lot off track with getting all of our visits, people moved. And so if you have kind of missed or fallen behind on health screenings, this is the best time to catch up before you're pregnant instead of, trying to get all of these things in place during pregnancy. This is your routine annual exams with your PCP or your gynecologist. Vaccinations is something that gets overlooked because there are some vaccinations you can get during pregnancy, like the flu vaccine or COVID is fine and safe to take during pregnancy. But some you can't. Measles, mumps, and rubella. We've seen measles on the rise again in this country. And that is one that you can't be vaccinated against while pregnant. So if you are behind on a booster or live in a place with a high rate of these conditions, it may be worthwhile getting the booster vaccination. Same with chickenpox. We cannot get that one in pregnancy, and so it's helpful to get it now if you're showing that you're non-immune, and you can ask your doctor about that. As well as HPV vaccine. This is one vaccine that we have currently that can potentially prevent cancer, cervical cancer due to HPV. And so a very important, part of the vaccination schedule that some people may or may not have completed ever. And so this would be a great time to catch up. And I've mentioned previously medications, particularly if you're on certain medications, we want you to use this time to check in with your doctor because there might be a recommendation to switch prior to pregnancy instead of kind of scrambling once you are already pregnant about what could work for you. So again, oral health care, dental care is very important to safe and healthy pregnancy. I don't know if, many dentists are doing enough PR about that, but actually, gum disease and inflammation and dental caries, the cavities actually increase your risk for preterm delivery. And so maintaining your oral health care, if you haven't been to the dentist or you need some dental work, this is a great time to do that. Pap smear screens, remember this is screening for cervical cancer, starts at age 21. Mammograms screen for breast cancer, typically start at age 40. And colonoscopies, we're hearing so much in the news about increased rates of colon cancer amongst younger and younger people. Typically, the screening for colon cancer now starts at age 45. I just put a disclaimer there at the bottom because screening may start sooner based on your personal risk and family history. So definitely ask about that. Chronic medical conditions, if they're present in your life, things like diabetes, high blood pressure, asthma, sickle cell, lupus, now is the time to make sure everything is tightened up and tuned up. We want to optimize management of any conditions because they may increase your risk of pregnancy complications. And so, again, getting on your doctor's radar, getting back in with a new primary. They possibly may need to start medication or adjust your medication, or even just updating surveillance if you're a cancer survivor, just to make sure that there is nothing that would potentially become an issue later in pregnancy, or just so that you're on their radar and you have connection and they can kind of stay close to you during pregnancy. There are reproductive health conditions as well that we want to check in on. And so, if you've ever been told that you had endometriosis, PCOS, uterine fibroids, we may want to check on that. Now is the time before pregnancy because there are different things that we can do before pregnancy that we can't do while you're pregnant. I would add to this, if you've had current miscarriage, which that means two or more miscarriages before, or more than that. If you've had surgery on your fallopian tube, say if you've had an ectopic pregnancy and had to have surgery, or if you're age over 35 or have irregular periods, it may be worth checking in with your gynecologist or reproductive endocrinologist like myself to figure out how that impacts your chances of success for pregnancy going forward. And so there are a few different things that we like to, manage in terms of lifestyle changes. And so I mentioned this as kind of keep versus toss. There definitely want you to start prenatal vitamins. The most important component of prenatal vitamins is the folic acid. And so folic acid has been shown to prevent neural tube defects. This is how the spine and brain form and also kind of like cover themselves completely during formation. And so folic acid is like the number one thing that we want you to have in your system prior to pregnancy. So you don't start your prenatal vitamins when you get pregnant, you start before. It helps to get everything replete. Folic acid, iron, and now prenatal vitamins are even including omega fatty acids because it's been shown that that also helps with fetal brain development. But omega fatty acids are good for you and your overall health too. And so if you're thinking about becoming pregnant, I would say in the next 3 to 6 months, even if you're on a woman's multivitamin, maybe you can switch it over to prenatal. Exercise. So, if you have a regimen that works for you, you do not need to stop just because you're trying to get pregnant. There might be nuances with that in terms of kind of more extreme athletic exercise or excess exercise. But we've seen, Serena Williams and all these other kind of athletes continue to train during pregnancy. And so there's no reason to think that you can't also continue exercise. But if you don't have an exercise routine, what better time to start than prior to pregnancy? You'll have the increased, cardiovascular benefits. Remember, we are training for this marathon, and getting your heart and blood and lungs and kidneys ready is part of that process. You may also have the benefits of weight loss or weight maintenance, and even things like, better sugar control if you're diabetic, or decreasing your blood pressure. And so exercise is an incredibly important tool, and something that you definitely want to keep. Nutrition is another. I get asked a lot about magic special fertility diets. It doesn't quite work that way, but there are things that maybe you want to be more mindful of. Making sure that your diet is actually balanced. Sometimes people who exclude whole food groups, like if you're vegan, may be lacking on B vitamins. And so looking for dietary sources of those things can be important. Making sure you have enough vegetables, enough fiber from complex carbohydrates, adequate protein sources as you get ready to kind of, nourish and prepare your body for nourishing a small human, then these are things that you want. And so this can be a fun time to experiment with new recipes and maybe cooking more or eating more at home as opposed to, some processed things or quick to go things that you normally would. But there are some things I definitely want you to toss. And I think most physicians would definitely put smoking at the top of that list. Not only does it actively work against this training for this marathon, it works against your cardiovascular health, against your lung health. It may, even increase your risk for, placental disorders, where we talk about babies that are kind of too small, not growing well enough, or hypertension of pregnancy like preeclampsia. It also, unfortunately, does a really bad number on your ovaries and your ovarian function, which can make it harder to get pregnant when you're ready. And so if this is something that you're struggling with, this is an excellent time to actively work on it. Everyone thinks it's so easy to just stop smoking when you're pregnant. It's not. And so if you want to be able to start that process, doing it prior to pregnancy is definitely going to be the best advantage for you. There's a group of chemicals called endocrine disruptors. And these, chemicals, unfortunately, are all around us in so many different things that we interact with. Plastics and the lining of canned foods, and even in beauty and wellness and hair products. And unfortunately, these things can make it harder for you to conceive, as they may kind of affect different hormone functions in your body. But they can also potentiate things like endometriosis and uterine fibroids if you have a particular susceptibility. And so trying to identify ways to eliminate endocrine disruptors is definitely something that you can look into prior to pregnancy. Teratogens is another, is a specification we give to chemicals that can cause, what do we call it, deformities, or anything that can make a pregnancy not grow and develop the way that it should. Some of the biggest ones that I think of are certain medications that you take, particularly mood stabilizing medications. But there are others. Common blood pressure medication can actually have issues with fetal kidney development. Even beauty products. We talk a lot about staying beautiful. We want to look young and healthy. But retin A or retinols are one of the top ones that we would actually want you to discontinue prior to pregnancy. So again, it takes a little prep. You may have to go back and talk to your dermatologist, let them know that you're planning for pregnancy, talk to your psychiatrist, let them know that you're planning so that they can get you on different medications that work well for you. Well, we don't have like too much time, because I do want to leave some time for questions. Hopefully there's a few kind of in the chat or in the question and answer section. But I think part of planning is kind of thinking about your timeline from now to pregnancy. And if that, looks like you're not really ready right now, or you may be taking a little bit longer than you anticipated due to work or life or finances, relationship status, then doing something like fertility preservation can actually be a very positive step in planning for the future that you want to be a parent ultimately. And so when we talk about fertility preservation, primarily most people think of egg freezing, but you can freeze eggs or use those eggs and create embryos and freeze the embryos. And I think it can be a very daunting process from the outside. Obviously, we see hundreds and thousands of women who do it every year. And ultimately, I think this is going to be a very big preventative step in reproductive health, like getting a pap smear, or getting a mammogram. In a certain sense, we may be able to not only screen embryos for genetic issues like sickle cell anemia, but also potentially give yourself more options for the future should you have infertility. And so what is oocyte cryopreservation? Oocytes are eggs. And so this is egg preservation. And it is safe. It is, something that's gaining in popularity, certainly. There are limitations on it. This does not solve all reproductive health issues, and so that's important to know. And for some people, it may be an expense, an out-of-pocket expense that they didn't anticipate because it's not always covered by insurance. More and more insurers are including egg freezing or embryo freezing as part of the insurance plan. But at this time, it remains something that you may have to pay for out of pocket, and therefore that could take some planning. What egg freezing is not, it's not a guarantee. Having an egg is not the same as having a baby. And so while it may give you more options, it's not exactly the same as saying, hey, I have, 3 children on ice. Not exactly. It's not really a shortcut. And so I don't think that this should be used as like, a fallback plan or an insurance policy, because unfortunately it's not that. It is a way to diversify your reproductive portfolio. When we're talking about, okay, you want some money invested here, some money invested here, some long term, some short term, that's how we can look at reproduction as well. We can think about freezing eggs. We can think about managing gynecologic issues like PCOS or endometriosis or fibroids. We can think about, okay, when is my deadline in terms of when would I want to have children by? And then how do I get myself healthy enough to do that? So it's a multi-pronged approach, and this can be part of that. It is not carcinogenic. Carcinogenic means it causes cancer. And the egg freezing process does not increase your risk for cancer. And so it's a very brief exposure to hormones that are very commonly found in your body. And then your ovaries make the rest of hormones by making estrogen and progesterone in response to the medication you take. And so I think that's an important kind of myth to dispel. It's not experimental. Once upon a time when we were kind of fine tuning this process, it had that banner. It has not had that banner since 2012. And so it is available to, people who want to use it in order to help them preserve their fertility for the future. So what exactly does it look like? Well, it's not as extensive as people think, but there is a lot involved. It requires 7 to 10 days of subcutaneous injections, and these contain the pituitary hormone FSH, which stands for follicle stimulating hormone. And so this stimulates egg development in the ovaries. Instead of making one egg, which we are, typically destined to do every month, there would be growth of multiple eggs. Now, we can only get the number of eggs to grow that your ovaries are capable of. So for younger women, that's going to be a much higher number than for women who are older, age 35 or 37 or older. But that is the purpose of the medication, is to get multiple eggs to grow and mature at the same time. So to monitor your egg growth while you're taking the injections, we rely on ultrasounds of the ovaries, which we do in our office. Typically transvaginal ultrasounds, although sometimes we can do transabdominal, which means the probe is on your belly, as well as blood tests. So typically when you're in an egg freezing cycle, we would see you over that 7 to 10 days, about every other day. These are quick visits, maybe 20, 30 minutes early in the morning before you go to work, where you would have these things assessed, an ultrasound, a blood work, and this allows us to know, one, how you're responding to the medication. Is it working? Is it doing what we expect? As well as when to actually remove the eggs, because that's based on how well your body responds to the medication. And so the actual egg retrieval is a surgical process. It takes 10, 15 minutes. It's not very long, but you are required to have anesthesia because that helps to keep you comfortable enough to do the procedure. I usually tell people, you will go home that day. There's no reason to stay and have to be admitted overnight or anything like that. Definitely want you to be off of work that day. If possible, it might be nice to be off the next day too, or have really kind of reduced or restricted activity like work from home, just so that you can make sure that you're comfortable before going back to work in your normal routine. You will also need an adult to get you home. And that's pretty standard anytime that you've had anesthesia, just to make sure that you feel okay, and can safely get you all the way home. Even if you take like a cab or Uber, you still need an adult to go home with you. And then it doesn't require more than oral pain medication when you're home. The eggs are actually retrieved through the vagina, through a needle that's guided by an ultrasound. So we can look directly with the ultrasound, use the needle to go into each ovary. There's no incisions on the abdomen. As I mentioned, you go home the same day. And so the day that the eggs are retrieved, they're actually frozen. We, retrieve them, they're examined under the microscope, assessed for what we call maturity, and then they can be frozen that same day. And, at this time, there's no upper limit on storage. We don't know if freezing eggs, for 2 years is better than freezing them for 5 years. There's really not that data at this point. There's some studies out that the average length of time of eggs frozen might be about 4 years, maybe 7 in another study. But one thing we know is with it becoming more popular and younger women freezing their eggs, we're going to see eggs that are frozen for much longer. And so there's no, kind of end date or D date that your eggs need to be thawed by. But with that in respect, you just make sure that you have a plan for them. And if you want to use them in the future, because it's not a guarantee, everyone may not need them. Maybe they achieve pregnancy on their own or decide that they don't want, to use these eggs to create a pregnancy. But if you do want to utilize them, you have to have a sperm source. So that it's either your partner or someone you're going to co-parent with or donor sperm. And what would happen is we would make a plan to thaw the eggs, inseminate them with sperm, and they grow into an embryo. And then as an embryo, it would be transferred into your uterus to create a pregnancy. So the length of time that the eggs are stored does incur storage fees. Eggs or embryos could be stored. But essentially, if you freeze your eggs at age 35 and you're ready for a family or, having difficulty achieving pregnancy at 40, then you would be able to use your 35-year-old eggs to achieve a pregnancy and should have a similar reproductive potential to 35 instead of closer to 40. So that's really, the crux of it. I didn't want to bombard you. I hope you felt it was helpful. But just bringing it back around to, Black Maternal Health Week. There's so much going on this week. I think that this is an incredible week of awareness and solidarity and very inspirational to see so much in the media. I think more this year than I've seen at any other year. I believe this is the 7th year of doing this. And it's been such a great uplifting experience. And I hope that this is also giving you the opportunity to feel like you have the power. You can be equipped with knowledge. I want to make sure that people know their bodies and trust yourself, and know that this is something that you can do and be safe. So I sincerely thank everyone for tuning in. I'll leave this up here for a while just in case you need my email address. But our physical location for RMA of New York, where I work in our Brooklyn office. This is in downtown Brooklyn at Albee Square. But we have multiple practices all around the tri-state. We are in Long Island. We have 3 offices in Manhattan, Soho, Midtown on 59th and Madison, and then one on the west side on 58th. And also 3 clinics in Westchester County. And so between those, we usually serve so many different people in our area. If you have questions about, booking a consultation with me or one of my many partners, as you see in this picture, you can absolutely do it through the website, so rmany.com. You can also call and we can get you in that way. You can reach out to me on social media. I have my IG handle there at the bottom. So I am just going to see if we have a question. So one that was posed says, you're planning for a pregnancy this year and need to schedule dental appointments and a mammogram. Are there any concerns to be aware of regarding radiation and timing for a pregnancy? In general, the amount of radiation that you get from a mammogram and dental appointments should not be harmful to either your body prior to pregnancy or before pregnancy. With dental exams, they usually provide you with like a shield that will go over your abdomen, and so really the X-ray should be mainly focused on like your mouth and head. But similarly with a mammogram, this is the perfect time to get up to date on these things before trying for pregnancy. And, there might be some resistance to scheduling you once you're pregnant. So I think this is a great time to do it prior to pregnancy. So if you need follow-up or ultrasound or a biopsy or anything like that, you can do it confidently. Okay. I'll leave this up here for just a minute. Feel free to kind of just drop any questions or comments in the chat. A few other things that I think about in terms of preparation. We talked a lot about, mental health. I think that, working with a therapist, particularly if you have unresolved issues, even if you feel like you're recovered past issues, things that you think of like eating disorders or obsessive compulsive disorders, anxiety, depression. I meet a lot of people now who are on ADHD medication that might not want to be continued in pregnancy. And so really taking advantage of this time to kind of work on that, make sure that you're in the best kind of mental space, but also, the thing about changing your medication is I want you to be on a regimen that works. So it may take some time to get there. So starting as soon as you can, I think is helpful. There's another question here that's open. What determines how many rounds of egg freezing are necessary? So the biggest determinant of, or a predictor of the number of egg freezing cycles needed is the age at which you're freezing your eggs. And the reason is, as we get older, the number of eggs that we have kind of decreases with time, but then also egg quality decreases with time. And so, when you're younger, you have healthier, higher quality eggs. And because of that, you may not need as many eggs to create a live birth as you would 5 or 10 years later. So as you get older, the recommendation is for a higher number of eggs frozen, but that also is at a time when when your ovaries have less eggs to give. And so in general, there's no kind of set in stone figure. But if we're seeing patients who are younger, we talk more about, 12 to 15 eggs. If you're over 35, I'm probably going to be talking to you 15 to 20 eggs. But then over 40, if you're freezing eggs at 40 or higher, it may be a bit of a challenge because you'll more than likely need more than one cycle of egg freezing if you want to be able to preserve those eggs with the intent to use them and create a live birth in the future. So I think the biggest determining factor is age, but also after you do a cycle, we see how many eggs you got. If you hit the target in one cycle, that's fine. If you want to kind of have a conversation about, okay, what is my chance of success with this number of eggs? We can do that. And then we'll let you know if we think a second cycle is needed or just kind of more like icing on the cake. Let me see. Can you talk to us a bit about IUI versus IVF? So these are methods of achieving pregnancy, usually for people who either are experiencing infertility or are single persons and need to, use sperm in order to achieve a pregnancy, or in a same-sex relationship. And so with IUI, that stands for intrauterine insemination, which means that sperm is kind of placed into the uterus with a little skinny catheter. And that is, it's timed to when you're ovulating, or we can give medication to kind of help boost the ovulation, trigger the egg to be released, and then place the sperm in usually about a day or a day and a half afterwards. So that's the IUI. IVF is very similar to the process that I described for egg freezing. So it's almost identical, except that you wouldn't be freezing the eggs, you would be creating those eggs into embryos and then using an embryo to place into the uterus. And so what determines which way to go can be several different factors. Age is always a big one, desired family size. But then if you're someone who's having trouble getting pregnant, what we find from the infertility evaluation may determine which way to go. If there's a low sperm count or if there's blocked fallopian tubes, you may need IVF. Versus if you're young, healthy with open tubes and normal sperm, then we may go with an IUI as the first route. So hope that answers your question. Let me see, there's another one here. Is there an age cutoff at RMA for freezing embryos if you have no fertility issues aside from age? Will you work with older patients that want to use their eggs and have good ovarian reserve? Yes, I would say it's kind of on a case by case basis. It depends on ovarian reserve, how easy it is to kind of see your ovaries and eggs and pelvic anatomy. And of course, there has to be counseling about, realistic expectations based on age, but it's not an absolute, hard stop at, any one particular age. Okay. Let's see. Been trying for about 5 to 6 months with no results. What should the next step be? This is for someone who's age 37. This is a great question because what applies when you're less than 35 is a little bit different than over the age of 35. So when you're less than 35, 34 and younger, we usually say to try for a year before coming to a fertility practice. But at age 35 and older, there can be more challenges to having pregnancy. And so that's why we say about 6 months maximum. The difference would be for younger people if you don't have regular periods, or you have a cancer history, or you have other known issues that can impact fertility, like fibroids or a prior ectopic pregnancy, which maybe means that you have damage to your fallopian tubes, then we would really want to see you right away. You don't have to try 5 or 6 months. And so for this person who's asking that they've been trying for about 6 months and age 37, the next step would actually be to see a fertility specialist. It doesn't mean that there's some huge issue that's wrong. What it really means is we want you in care sooner so that we can help you to achieve pregnancy faster. That would be the goal instead of, continuing to try and wait on your own. Next question. If you need 2 rounds, how long after the first round should you wait? That is totally up to you and the individual condition. If you need more than 1 round, sometimes people will go into it right away and there's no detriment from doing that. There's nothing bad from doing that. Some people prefer to wait a month or 2 so they can have a break or, focus on work or exercise or something, and that's totally okay. There's no impact from waiting up to 6 months in between cycles. There's no change that we would anticipate. How long is the IUI process? It's on the order of your period. So the same way you get a period every month and you have an opportunity in the middle of the month to get pregnant, and by the end of the month, you know if you're pregnant or not, similar to an IUI. It goes on with your menstrual cycle. So it starts when you get your period and it ends with either getting your period or having a positive pregnancy test. So it's like 1 month per IUI cycle. Not a question, but a big thank you for your presentation. Well, thank you so much. That was great and inspiring information. This is a woman's health nurse practitioner student. ICU nurse in a same-sex relationship planning for pregnancy next year. Oh, big thank you. Definitely going to reach out. That's awesome. So excited for you guys. It's important to know this information for yourselves, for your patients, for your friends, and definitely share what you've learned. What happens to your eggs if for some reason you do not end up using them? This is a great question. And so if you don't want to use your eggs, they're just discarded. They cannot exist like if they are not being made into embryos or frozen, which is kind of suspending them in frozen animation. And so there's nothing done to them per se. If you do not want to use them and you tell us you want them discarded, they would be thawed and discarded. They're not given to anybody else. That was great. Thank you. Well, I'm glad you enjoyed it. I really hope this was helpful. Maybe we'll have more of these in the future. Who knows? But I think at least to just, look at this as a positive experience. Look at this as a blessing to be able to kind of plan and prepare and get things together the way that you want to have this vision of pregnancy that you want for yourself and for your family. And enlist the help that you need along the way, the support from family, friends, from your partner, from your community, from your physicians. And so I hope everyone had a great night, and we're going to log off. Have a good night. Bye.